Go to your bathroom shelf for a second. Pick up the eye drops you've been using lately, turn the bottle around and read the active ingredients. If you see one of those redness relief ingredients with a long chemical name you can barely pronounce, there's a good chance you've been putting something into your eyes that gives quick comfort, but may be making the real problem worse over time, especially if you're over 60. And that is exactly what most people never get told. I'm Dr. Anna, and in this video, I'm going to show you which common eye drops many older adults should be careful with, which types are usually much better choices, how to tell what kind of dry eye you may actually have, and the simple daily habits that can make a bigger difference than another bottle from the pharmacy shelf. If you care about healthy aging, clear vision, and practical health guidance without hype, subscribe to I share straightforward videos designed to help you protect your health with real-world steps you can actually use. Here's the pattern I see again and again. Your eyes start feeling dry, tired, slightly gritty, maybe a little red by late afternoon. So you buy a bottle that promises fast relief. You use it. For a short while, your eyes feel better. Then a few hours later, the dryness comes back. Sometimes the redness looks even worse. So you use the drops again. Days turn into weeks. Weeks turn into months. And before you realize it, you're using more drops, more often, with less and less real relief. That is not always because your eyes are just getting old. Very often it's because the drop you're using is only masking symptoms for a short time instead of helping the actual cause. In some cases, frequent use can even irritate the eye surface and keep the cycle going. So before we talk about which products to avoid, we need to understand one thing most people were never clearly taught. Your tears are not just water. Before we go deeper, let me be very clear. Some eye symptoms are not routine dryness and should never be handled by guessing with over-the-counter drops. If you have sudden severe eye pain, sudden loss of vision, flashing lights with a curtain-like shadow, intense headache with nausea and halos around lights, or a rapidly worsening red eye with heavy discharge that needs urgent medical attention, call an eye doctor or get emergency care right away. This video is for the much more common situation, eyes that have gradually become drier, more irritated, more tired, more sensitive to wind, screens, reading, indoor heat, or long days. Your eye is covered by a very thin tear film that protects, nourishes, and smooths the front surface of the eye. And that tear film has layers. One layer helps the tears spread evenly across the eye, another supplies moisture, and the outer oily layer slows down evaporation so the moisture doesn't disappear too quickly. That last layer matters more than most people realize. As we get older, the oil-producing glands in the eyelids often become less efficient. Their secretions can thicken. The gland openings can clog, and the tear film becomes unstable. That means your eyes may technically still produce tears, but those tears may evaporate too fast to protect the surface properly. So the eye feels dry, burning, gritty, or tired, even if the main problem is not lack of water, but poor tear quality and poor tear retention. That's why many people keep using watery drops over and over and still never feel fully better. For a large number of adults over 60, the biggest issue isn't simply low tear volume. It's instability of the tear film, especially the oil layer. And when that happens, certain common drops can become a trap. They may temporarily improve comfort or appearance, but they don't solve the underlying issue. Some are fine once in a while. The problem begins when they're used frequently or daily for long periods. So let's get practical. The first category is redness relief drops that work by shrinking surface blood vessels. These drops can make the eye look whiter fast. That's why people love them. The problem is that when the effect wears off, the blood vessels can open back up again. Sometimes they become even more noticeable than before. That creates a rebound cycle. More redness, more drops, more dependence. If you use that kind of product once in a great while for a special event, that is very different from using it day after day. For regular use, especially in older adults with ongoing dryness, these are usually not the best answer. The second category is preserved eye drops used many times a day for weeks or months. Preservatives are added to many bottles so they stay sterile after opening. That makes sense from a packaging standpoint. But some preservatives can irritate the delicate surface of the eye when used too often. Infrequent use is one thing. Repeated daily use is another. If you're reaching for drops several times every day, preservative exposure can become part of the reason your eyes stay irritated. This matters even more with age because the eye surface may already be more vulnerable, more sensitive, and slower to recover than it was years earlier. The third category is allergy or antihistamine eye drops used regularly when allergies are not the real issue. If you truly have seasonal allergy symptoms, itching, watery eyes, sneezing, pollen exposure, those drops can be useful. But if your main problem is chronic dryness, using allergy drops all year long may not help the way you think. In some people, they reduce the itch but do nothing for the actual dryness pattern underneath. So the user assumes the drops are helping, while the surface remains unstable and uncomfortable. The first better category is preservative-free artificial tears. These often come in small, single-use containers. Because they're meant to be used and discarded, they don't need the same kind of preservative load that many multi-use bottles have. If your eyes are irritated several times a day, this is often a much safer direction than repeatedly using preserved redness relief drops. The second category is lipid-based drops, sometimes called emulsion drops. These are especially helpful for people whose tears evaporate too quickly. In other words, people who don't just need moisture added, they need better support for the tear film so the moisture stays in place longer. For many older adults, this type of drop makes much more sense than endlessly reapplying thin, watery drops that disappear too fast. The third category is hyaluronic acid eye drops. These are popular because they tend to hold moisture well and provide longer-lasting comfort for many people. They're often a very good option for dry, irritated eyes that need smoother, more persistent support. Some people do well with preservative-free tears during the day and a lipid-supportive or longer-lasting drop in the morning or evening. The point is not brand obsession. The point is matching the drop type to the problem. Let me give you an example. Imagine a 69-year-old woman who starts using a redness relief drop because her eyes look tired and pink by evening. At first, one application works. A few months later, she's using it more often. Then she notices her eyes feel drier. She thinks the answer is to use even more. Eventually, she reaches the point where her eyes are red almost every day, uncomfortable most evenings, and she assumes aging is the whole reason. Then she stops the redness relief drops, switches to preservative-free lubrication, begins supporting the tear film properly, and within a couple of weeks, the cycle finally begins to calm down. That is more common than people think. The product that looked like relief had quietly become part of the problem. Now let me show you a quick self-check. Sit down with your phone, tablet, or computer and read something normally for 1 full minute. Don't force anything. Just read the way you usually do. Then ask yourself, how often did you blink fully? When we focus on screens, blink rate often drops, and incomplete blinking becomes more common too. That matters because blinking helps spread tears and gently express the oil glands in the eyelids. If you spend long stretches staring at screens, reading, or doing close work without full blinking, you are making evaporation worse. So one of the most underrated dry eye tools is not a product at all. It's better blinking. If you sleep in a room with indoor heat or air conditioning and very dry air, your eyes may be losing moisture for hours overnight. Then you wake up already behind. That's why morning dryness is so common. A bedroom humidifier can help more than many people expect. The second habit is continuous screen time without breaks. When you stare, your blink rate falls. The tear film gets disrupted. The eye surface dries faster. A simple routine like looking away every 20 minutes and blinking fully a few times can make a real difference. The third habit is not really a habit, but it matters: medications. A number of common medications can contribute to dry eye symptoms, including some antihistamines, certain blood pressure medications, some antidepressants, diuretics, and other widely used prescriptions. That does not mean you should stop them on your own. It means if your eyes have become much drier over time, your medication list is worth reviewing with your doctor. If you've been using redness relief drops every day, stop treating them like a long-term solution. They were not designed to solve chronic dry eye. Get a preservative-free artificial tear and use that instead when you need frequent lubrication. If your eyes feel dry again quickly after using ordinary drops, consider a lipid-based or longer-lasting formulation that supports evaporation-related dryness better. Use a warm compress over closed eyelids for about 5 minutes in the evening. This can help loosen thickened oil in the eyelid glands and improve tear quality over time. Use a humidifier if the air is dry. Blink fully during screen time. Take visual breaks and pay attention to patterns. Worse in the morning, worse at the computer, worse with heat, worse after certain medications. Most people think the answer to dry eye is simply more drops. But if the wrong type of drop is being used, more drops can mean more irritation, more rebound, or more frustration. The goal is not just to wet the eye for a few minutes. The goal is to improve the environment of the eye surface and support a healthier tear film. That is why identifying the category matters more than chasing brand names. So if your eyes are dry, here's the better question to ask. Is the problem redness? Is the problem irritation from frequent preserved drops? Is the problem fast tear evaporation? Is the problem allergy? Or is the problem a combination of aging, environment, blinking patterns, and gland function? When you ask the right question, your choice becomes much smarter. If you're over 60 and dealing with ongoing dry, irritated, red, or tired eyes, be cautious with 3 things. First, regular use of redness relief drops. Second, heavy use of preserved multi-use drops. Third, allergy drops used long-term when allergies are not the real problem. And look toward better options like preservative-free artificial tears, lipid-based or emulsion drops, and hyaluronic acid drops. Then support that with warm compresses, better blinking, less screen strain, and healthier humidity. Before you go, tell me this in the comments. What kind of eye drops have you been using most often? Redness relief, allergy, or artificial tears? And if you found this helpful, subscribe. I'm Dr. Anna, and on this channel we focus on practical health guidance for adults who want clear, simple, evidence-aware information without confusion or gimmicks. If you know someone over 60 who keeps buying the same bottle again and again but never seems to feel better, share this video with them. It might help them break the cycle. I'm Dr. Anna. Thanks for watching, and take good care of your eyes.